Hi, I'm Bahn, a PhD candidate at Queen Mary University of London and clinical Syrian lecturer at College of Dentistry Al Mustansiriya University in Iraq. It's a pleasure to be presenting for the second time in IAOR Iraqi branch conferences, and this time will be in Ankara. So today I'm going to talk about my research regards to three-dimensional evaluation of head and body posture in adults with sleep apnea. So my presentation outline will be background, then I will explain AIMS methodology, and finally present the result and conclusion. I will use the abbreviation OSA instead of obstructive sleep apnea hypopnea syndrome throughout my presentation. So to start with, OSA is characterized by repeated collapse of the upper airway for more than 5 abnormal respiratory events per hour. Its affects middle age group with men to women ratio 2:1. It's significantly underdiagnosed and undertreated condition with health economic impact. These may include daytime sleepiness, increased cardiovascular morbidity and mortality, motor vehicle accidents, and decreased quality of life. And all these, they are a risk to us. A number of cephalometric studies has reported extended head posture in obstructive sleep apnea, proposing the effect of airway obstruction on the craniocervical posture. The literature presents some disparity in regards to terminology, head position and head posture. And it looks like they are interchangeable, but in reality they are not. So head position is vertical position of the head in relation to the horizontal plane, while head posture is anteroposterior of the head in relation to the body. So let's see some definitions. For example, natural head position was introduced by Broca in 1862, which refers to standing position with visual axis horizontal. And later on, Maurice in 1958, he bring a definitions which is ortho position, which is standing to a walking position. So the early two definitions, they talk about the natural head position is about standing, and they are looking to the horizontal axis. So there is different parameters to measure the head posture, which are distance between tragus and shoulder. So this is tragus and this is shoulder. And the other distance is between tragus and C7. And there is an angular measurement called craniovertebral angle, which is the angle between tragus, C7 line and horizontal. So the aim of this methodological study was firstly to determine the most reliable measurements of head posture in the standing position. Secondly, to explore the reliability of head posture measurements in seated position. And finally, to quantify the magnitude of change in upper body position in the seated position. So, 10 males with OSA condition were invited to participate in this study at Royal London Hospital in the UK, and we used a 3D surface imaging system as shown, 3D torso system, and also a class 1 cross-line laser with permanent markers. So for the purpose of registration of self-adjusted head position, so subject asked to stand inside the cone-beam CT machine in their self-adjusted natural position without X-ray exposure. The head position was registered using built-in cross-line laser beam. And there is 4 doors were placed on the vertical and horizontal. 3D image were taken for each subject, 1 in standing and 2 while seated. So then stereophotogrammetry has been done, which is a facial analysis, and then histogram has been used for superimposition. And these are the marks, which are tragus, back point, C7 left and right shoulder, and we used 2 measurements, which are craniocervical angle and also mid-tragus C7 angle. So this is the angle and the distance, mid-tragus C7 distance, to measure the head posture. And you can see it's mid-tragus because we're passing a line between 2 tragus, and then we measure the distance between C7 and mid-tragus here. And you can see from 3D dimension here. And this photo showed the difference between normal head posture and forward head posture. And you can see how the head sitting forward in relation to the body and the forward head posture, while the normal, you can see the head is aligned with the body. And the measurements, the mid-tragus C7 distance is shorter in normal than in forward head posture patient. And to quantify the difference between the body position standing versus sitting, we superimpose them using superimposition tools for 3DMD Voltus software. And we can see that the histogram here show the difference between standing and sitting position without instructions. And the histogram is color coded, and you can see the pink color represent the positive movement of the body, is movement of the body forward, so giving a positive measurement. And for test and retest reliability, we found mid-tragus C7 more reliable than a craniovertebral angle, and you can see the reliability is about 0.98. It's excellent reliability in comparison with 0.74 for craniovertebral angle. In regards to reliability or accuracy of mid-tragus C7 distance between standing and sitting, we can see there is no significant difference between standing and instructed sitting. In comparison, there is a significant difference between standing and non-instructed sitting, and also between sitting instructed and non-instructed. And this shows that standing is the golden standard for measurement of head posture for all patients. However, if we could give instructions that simulate the standing position while patient seated, it will mimic the standing position. These 3 photos show the difference in the C7 mid-tragus distance between standing, instructed seated and non-instructed seated, and you can see the instructed seated is the highest or the largest measurement 121 in comparison in standing 116. So the head is extended a little bit forward while the patient is seated if they are not instructed. And also we measured the displacement of 4 landmarks, which are back point, C7 and right and left shoulders points. And you can see here the most point that displays from standing to sitting position was the back point, while the patient seated without instruction. And you can see there are the measurement was 23 millimeter displacement, while if the patient instructed the measurement, the displacement less, massively less, about 4 millimeter only. So you can see the significant difference between instructed and non-instructed landmark displacement. And also it's much less with C7 and right and left shoulder measurement. And this is a photo, an example of displacement of back point between standing and non-instructed seated, and the measurement was, our displacement was 15 millimeters here. So a standard operating procedure has developed to reproduce the natural and head position while patient seated. So we ask the patient to stand first and look forward and move their head right and left, up and down until they feel comfortable. And then we bring the cross laser beam and use markers to capture the head position while patients standing. We place the dots on the face following the cross laser beam, and then we ask the patient to sit upright in an adjustable chair without back support, and we ask the patient to place their feet on the floor and allow their arm to hang alongside the body, and the hands directly on their legs and look directly ahead. And then we decorate the head position by using the cross laser line and to adjust the head if there is any tilt or rotation. So in conclusion, the mid-tragus C7 distance was the most reliable measure of head posture. A significant difference was observed in head posture between non-instructed seated and standing positions, and a standard operating procedure was developed to record the natural head posture in a reproducible manner while seated. I presented this research in IAOR conference last June in Vancouver, and it was selected as a top 7 research, and I awarded Innovation Award for Excellence in Orthodontic Research. Please, if you need any information, just email me on this email address on the screen, dr_bano2005@yahoo.com. I'm very happy to provide you any further information. Thank you very much. Bye.